Hey everyone, it's Dr. DeCubulos here. I wanted to go over a question that I get asked quite a bit, and I think people don't really understand what the difference is. So I want to talk about the difference between active and passive therapy. Very, very different. They're done for different reasons, and they're usually done at different times too. So let's start talking about passive therapy. So passive therapy is going to be a therapy that you're on, but you don't have to do anything. So what I mean by that is it might be electrical muscle stim. It might be massage. You're just laying there and someone is then doing a therapy on you or to you to help the injured area heal. So now passive therapy is usually more in the beginning of treatment when you're in a lot of pain and you can't do as much. So we rely more on passive therapy. Now on the other hand, active therapy is going to be exactly the opposite. It's going to be ones where you are actively doing something. So it's not going to be just you standing there, but it might be you doing stretches. It might be doing strengthening exercises. It might be doing core building. It might be doing proprioceptive exercises. It might be doing balance training. All those are going to be active. Now, as you kind of saw as I listed those, there's lots of different active therapies and they vary in difficulty. So at first we might not start out doing strengthening. We might start doing balance training. It all depends on where you are, what the injury is. But you can always move up, even when it comes to strengthening. We can do light postural strengthening versus very, very in-depth muscle building strengthening. So it just depends on where you're at. But that's kind of the difference. Passive is going to be done to you, and usually in the beginning of treatment. Active is you actually doing something, and that's going to be more as you move on. You're going to be doing more and more of that, or harder, more difficult types of therapy.